So why would I need a midline, you might ask? If the patient has a need for IV treatment under 30 days, then a midline is indicated. If the patient has need for partial parenteral nutrition, then a midline is appropriate. If there has been more than 3 failed IV sticks, then a midline is warranted. Palliative or hospice care is also an indication. Some consider temporary administration of a single vasopressor up to 48 hours controversial, but we are going to show that this is evidence-based. This is the actual protocol for vasopressor administration through midlines developed and published by North Shore Long Island Jewish Medical Center in 2015. Our protocol reads the following and is based off of this published study. Administration of vasopressor therapy through midlines can safely occur at our facility, but there are rules to this practice and are as follows. The decision to use vasopressors must be assessed and approved by a physician. Volume status of the patient must be evaluated via ultrasound technique or clinical assessment prior to peripheral vein administration of vasopressors. Patients must have a clinical indication for the use of vasopressor therapy. Peripheral venous vasopressor use is indicated for a maximum of 48 hours. However, therapy may be extended under the discretion of a physician. Peripheral venous access may be used for only one vasopressor. If multiple vasopressors are required, a central line is warranted. Access, insertion point, and hardware. Midline catheters cannot be placed in the antecubital region, hand, wrist, lower leg, or foot. Midline catheters must be placed in the forearm, upper arm. Insertion must be contralateral to the blood pressure cuff. Intravenous catheters must be at least 20 gauge or larger and inserted or verified with ultrasound guidance. There must be blood returned from the IV catheter prior to vasopressor administration. The IV site must be assessed every 2 hours while vasopressors are infusing, and site assessment performed and documented. We have been using this protocol for nearly 3 years now without any issue. Thank you for watching. If you enjoyed this content, consider liking the video. Leave us feedback in the form of a comment if you have any questions, concerns, complaints, or compliments. If you want to see more content like this, consider subscribing to see more footage like this. Till next time, stay safe.